No, not go. Don't go there. Go to Ask Dr. Ferguson, AskDrFerguson.com. The center of the page, you'll see a little writing that says Live Radio. If you click on that, that will take you to my YouTube site. At which time there'll be a little house in the top left-hand corner. Click on the little house and then click on Feed, and you'll be able to catch the program live. So we have more and more people that have been joining us each week on the World Wide Web. And for those of you who don't do much on the computer, the World Wide Web means exactly that. Anybody throughout the whole world could tap into this program and partake and listen and interact with us. And those of you who are locally that want to do that, you can do that. If you do decide to look at the program live, then you want to turn off your radio because there'll be a feedback, and it's about a 30-second delay. So I want to welcome those of you near and far to our program today, and our goal always is to provide some preventive health care information that you can use immediately. And many times the program is springboard from someone asking me a question, someone calling in with a question, and then I'll take that question and kind of run with it and talk about that topic on that particular day. The last couple of weeks we've been talking about diabetes, and I've had several more questions about diabetes, so I thought we would continue on that topic just a little bit, and then maybe we'll branch off from there. So for those of you who don't know what diabetes is, you hear a person say they have sugar. I got that sugar. I got diabetes. I have to watch my sugar. I have to watch what I'm eating. What is diabetes? Diabetes, for most people, is your cell's resistance to the use of insulin. Insulin is in your body. It's made by your pancreas. And when you eat, your body puts out insulin to help the nutrients that are in the bloodstream. Well, let me break it down a little simpler. You eat your food, you chew it up, the saliva in your mouth begins to digest it, it gets to your stomach, the enzymes and acid digest it further, breaks it up into nutrients that your body can utilize, your proteins, your fats, and your carbohydrates. And then it gets into your body. Now, once it gets into the bloodstream, your body wants to utilize the protein, the fats, and the carbohydrates. Well, they get broken down further. The protein gets broken down to amino acids. The carbohydrates get broken down into simple sugars. So it gets broken down into a way in which your body can utilize it. So all those little particles are floating around in your blood, and they're floating around, and then the cells say, I need something to eat. And so all of your blood cells say, I need something to eat. Well, in order to get something to eat, you have to have a key to get into the door. And the key to get into the door will be the insulin. So you put the insulin key in the door, and the door opens, and now you can let some of the nutrients get into that particular cell, and now that cell can eat. Now, insulin is primarily working on the sugars. I mentioned the carbohydrates. I mentioned the fats and the proteins. So insulin's not really working on those. It's working on the sugar part. So the insulin puts the key in the door, it lets some of the sugar in, and then the cell can have a good meal and can be happy. But what happens in diabetes is the lock doesn't work so well. The key is bent. The key's rusty, and you got to kind of put it in and jiggle it a little bit before you can get the door open. And that's what I'm referring to as insulin resistance. So when you become diabetic, your cells become resistant to the insulin, and the longer diabetes persists, then the more resistance that will persist. This is why when a person first starts out, they're able to control their blood sugars with medicine by mouth, but as time goes on, they often need insulin. One, because the cells have become more resistant to insulin, and two, because the pancreas over time will put out less and less insulin, so now it's not putting out enough for you to bring your nutrients into those cells. Did that make sense?
Yes, it kind of does, doctor, if you're a doctor.
Okay.
but just a regular person like me and maybe some of the
Okay, well, ask me something about that, because I tried to break it down just to a real simple basis just then. What about that did you not understand, so that our listening audience is going to be in the same category you're in, and we want to make this understandable?
Well, actually, I'm kind of following you, but as you was talking about diabetics, and I know that diabetics, they give themselves insulin shots daily.
Okay.
And what would cause that?
Okay,
why would that?
let's go back. Let's go back because you kind of missed part of the explanation. Diabetes it means is a resistance. Your cells are not able to utilize the insulin the way that they want to. They're resistant to it. It's like when you're having a well, it would be. I'm trying to think of another example here. When I'm saying resistance, I'm saying that your cells aren't as responsive as you would want them to be. When you're driving a car and the steering wheel is very tough, it's very stiff. So you try to turn left, you have to really work hard to turn it left. That would be resistance. Okay? And so say you try to turn the car the other way and it's hard to turn. That would be what I would call resistance. So what's happening inside your body is your cells are resistant to the insulin. It's not responding to the insulin as easily and as nicely as you would want it to.
Okay, I understand.
And so when that happens, that's generally what we're talking about when we talk about diabetes. It's an insulin resistance. That's where it starts out. That's usually what we're talking about, type 2 diabetes. When you talk about type 1 diabetes, that's more than an insulin resistance. That particular person is not making enough insulin, period. And so you have to give them insulin from the very beginning in order to help them utilize their carbohydrates and their sugar nutrients.
Okay, I understand it.
Carbohydrates is a long-chain sugar. And so what happens in your body is that carbohydrate gets broken up into simple sugars, and now your body can utilize it.
Okay.
And the way your body utilizes it is insulin helps your body do that. And where does insulin come from? Insulin comes from the pancreas. So if your pancreas is not working well for one reason or another, or if some other issues could be going on, but the pancreas is where the insulin is produced that helps your body utilize the nutrients. So is that part clear so far?
Yes, sir. It's much more clear now. Thank you.
All right. So now we've got your body. You're becoming diabetic because your cells are not responding to insulin as well as they used to. So what happens here is where maybe it used to only take 10 particles of insulin to get you to respond. Let the nutrients into the cell. Maybe now it takes 20, and then 30, then 40, and then maybe it takes 100 particles, where it used to only take 10 particles. And that's how many. That's what it would take to get you to allow the nutrients that are floating around in your blood to make it into the cell to give the cell the energy it needs.
Okay.
Okay. When you talk about sugar, we often talk about energy, because sugar is utilized by our body for energy. It's also utilized by our body as just to help us to get along and to do what we need to do. But sugar is kind of like, you could make it not completely accurate, but you can make it kind of synonymous with energy. If you need energy, you need sugar.
And thank you for clarifying that, because I was wondering the benefits of sugar in the body, and now I know that it gives you energy.
Right, but that's a little too simple, but that is one of the things. You also get energy from your proteins and your fats. So energy is one of those sources of, sugar is one of those sources of energy.
Okay.
And now your brain lives on sugar. Your brain, about 80% of its nutrients come from sugar. And so if you don't have sugar in your body, your brain's not going to function right. So in all that get an understanding, it's like cholesterol. People hear about the word cholesterol. I say, oh, too much cholesterol is bad for you. Yeah, but every cell in your body has to have cholesterol. The cell membrane is made up largely of cholesterol. And so if you don't have cholesterol, then you're not going to be making your cells correctly. So the key here when you're talking preventive health is that you have a balance. If you wrap your arms around the word balance, then we'll be moving in the right direction. A balance is what we're after, a balance of the carbohydrates, a balance of the fats, a balance of the proteins, a balance in your exercise, a balance in your sleep, a balance in your water, a balance in your interaction, a balance in your stress. Okay? What preventive health in the nutshell is having a balance in these different things that are happening in your life.
Okay.
And that's going to be our key, our foundation for preventive health is a balance. And so it's no one specific thing when you say preventive health, but the overall goal is a balance.
I wish I was taking notes because I find this very interesting.
Okay, so we've hopefully got the foundation of what diabetes is. Okay, and now a person can become diabetic at any time in their life. They could be born with their pancreas not producing any insulin, and then they will be a type 1 diabetic. But for the most part, most of diabetes in the United States is going to be type 2 diabetes, and it's going to be coming based on environment and diet. Now, there is a genetic component for sure, but more diabetes than not, particularly in children that are coming down with diabetes these days, is more supersized than anything else.
But doctor, let me ask, would type 1 diabetes be more detrimental to your body than type 2?
Not more detrimental. The one refers to your pancreas not putting out hardly any insulin, or not nearly enough, so you need to give your body insulin from the outside. The other one, your pancreas is putting out insulin, or maybe not enough, but the bigger key is your cells are being resistant to the insulin that is putting out. And so you're going to need more and more insulin to overcome the resistance.
Okay.
And once that happens, and you've reached a peak where the body can no longer overcome the resistance that the insulin in your body is producing, then you have to get some insulin from outside. That's when you give a person an injection. And so that's giving them some additional insulin to help their body utilize those nutrients.
Dr. Ferguson, I know a lot of people has heard or known someone who has diabetes and think it may be a nick or cut or something that they have to end up being an amputee.
Well, the question is, I think you're suggesting the side effects associated with diabetes.
Yes, sir.
And there are many side effects associated with diabetes, and that's kind of a jump from where we are, but we'll jump there real quick. We're more trying to give a foundation and an explanation of diabetes, but we'll jump to side effects.
Well, take your time and you do it. You're the doctor.
When a person has diabetes, and the longer you have diabetes and the more out of control your diabetes is, the more likely you are to come down with long-term side effects. What are some of those long-term side effects? Difficult with your vision. So your vision becomes blurry and foggy, and you're not seeing as well. A lot of times, if you're just becoming diabetic and your sugars have been out of whack for a long time, but you've never started to get treatment, you notice your eyes are getting more dim, more blurry, more difficult seeing things, and then you start getting treatment, your sugars come under control, and a lot of that poor vision comes back. So that's one of the issues that's very common with diabetes, is vision problems. Another one that's real common, and probably the more devastating one that more people know about than not, and that would be the amputations. Well, what about diabetes leads to an amputation? When you have diabetes, you have a disruption in the small blood vessels that go to the different organs and they come out to the skin. So, for example, if you're going to travel a major highway, that major highway will get you to the city. So you're going to go from Florida to California. Okay, you're going to take a major highway all the way. But as long as you're on that major highway, you can't get to anybody's house, right?
Right.
So what are you going to have to do to get to somebody's house? You're going to have to get off the major highway, and you're going to have to get on some smaller roads. And so what happens? You get on a smaller road, maybe not as big as a major highway, but still not a real small road. And then you get to another road, maybe not as big as the previous one, and then maybe you get to a road that may be single lane and maybe one way. Now, by the time you get to that single lane, one way road, you're usually a good little ways off the highway, and now you can get to that person's house, and they got to have a driveway if you're going to pull into the driveway.
That's right.
If their driveway is all disruptive and people have torn it up, then you can't pull into the driveway. And maybe the yard is messed up, so you don't have any way to walk to that house. Okay, so what I'm describing is what happens in diabetes. The big vessels are usually stay pretty intact. That's the major highway. But what happens is the side streets begin to become disruptive, and that will be the blood coming from the deep big vessel out to the skin. And so the more and more disruption you have in those side roads, or for example, the more difficult it is to get to your house because you got to go past the side roads, and then when you get to the house, you got to have some way to get into the house. If you got a big hole all the way around the house, you can't even get to the house, although you can see it. In diabetes, what happens is your blood supply is there, but it has a hard time getting to the place it needs to get to. And it's a hard time getting out to the skin, getting to the tissue it needs to get to. So what happens in diabetes, they have a hard time healing a wound. So if you get a wound in diabetes and it's taking a long time to heal, it's because your blood supply to the area has been disrupted.
Okay.
Okay, so that making sense?
Makes a lot of sense.
Okay, so as your blood, the more and more disruption in your blood supply, the more and more side effects you'll have in that particular extremity. So if I can't get blood to my foot, the first thing, my foot will start to give me some pain and tingling and be uncomfortable. And then it will start to feel numb. And then it will start to turn colors, and then the skin will start getting darker. And then if I still can't get blood to the foot, the skin will begin to die. So then it will get black. And then if I can't get blood supply to the skin, I'll get a scab, and I'll get more, the skin will begin to die and will begin to slough off, and maybe I might get something like a blister. And by this time, we would generally be referring to that as wet gangrene. Gangrene is suggesting that the tissue did not get the blood supply it needed and it died. And so when that happens, now we've got a wound to the foot that won't heal and it's getting worse. So that's what leads to the amputation.
Okay.
Now sometimes you can do a vascular procedure, and you can do like putting a new highway in. You can put a highway in that jumps from a place where you got good blood supply down to the foot where maybe you don't have good blood supply. But you still have to be able to get the blood supply out to the tissue. So even if you get it to the foot, you still got to get it to the skin and out to the other tissue. And so that's many times the problems in diabetes. Even if we can get blood supply to the area, we still can't get it out to where it needs to go. Say like, you know, say Haiti had all those problems with the famine and the water and all this stuff like that. So we got the food on the ships. We got it all the way over to Haiti, but then we couldn't get it off the ships to the people. They can see it on the ships, but we can't get it to the people. That's the kind of scenario you have with diabetes. The blood supply gets down to the foot many times, but it can't get out to the tissue. And if it can't get out to the tissue, now you can't carry oxygen to the tissue, you can't carry nutrients to the tissue, you can't take away toxins from the tissue. So all of that kind of builds up right there at the tissue. One, it doesn't get the nutrients it needs, it doesn't get the oxygen it needs, and plus it builds up in toxins, it builds up in waste products that should be taken away.
Okay.
And all of those things in combination are going to begin to lead to more and more problems with that particular extremity. And then eventually, usually going to be amputation.
Wow.
So does that make sense?
Sure, it really does.
Okay. So that's another big problem in diabetes. Probably the one that people know more about because it's probably one of the more devastating ones. But prior to that, there's lots of other problems that a person can have when they have diabetes. They can have erectile dysfunction. They can have poor circulation anywhere in their body. And one of the things that contributes to this more than anything else is probably smoking. So when you're diabetic and you smoke, it's a double-edged sword, because now you're disrupting the blood supply that makes it to the tissue, not just because of diabetes, but because of the smoking. Smoking also is a major disruption of blood supply out to the tissue, because it causes what we call an acceleration, an increase, more of developing what we call atherosclerosis, which is hardening of the arteries. Well, if the artery gets harder and harder and harder, that means less and less blood supply gets to that particular tissue.
Okay.
And if blood supply doesn't get to a tissue, then what does the tissue do?
Tissue dies.
It dies. And then when the tissue dies, now we've got a complication. Now we've got to try to get blood supply to that area, and if we can't, then we're going to have to amputate to an area where we can get blood supply. A lot of times people will say, well, you know, the diabetic, he's only got problems to his big toe, he's only got problems in his foot. Why are you taking off the whole leg? Well, again, based on what I just said, you have to have the blood supply making it to the tissue in order to heal the wound. So if you have problems with diabetes and you have problems in your foot, and they say they're going to have to take off your leg, maybe your lower leg, he said, why my lower leg? I only got a problem with my foot. Well, the doctor will assess how good your blood supply is to the tissue that needs to be taken off. And if the blood supply is not very good at that level, then the doctor will have to go higher. And then it may go what we call above the knee. So you have below the knee amputation, which is what we call a BKA. And then you go above the knee, you'll have what we call an AKA, above the knee amputation. And in that case, most times by the time you get above the knee, you have enough blood supply to the area that it's going to heal a wound. But that is definitely one of the bigger things that happens in diabetes, as well is not having circulation to the tissue. One of the more common things would be what we call peripheral neuropathy. That's a tingling, decreased sensation to the extremities, and this is the kind of thing that leads to further problems, because if you have tingling and numbness and decreased sensation, well, if you step on a nail, if you scratch your foot, if you injure your foot, maybe you don't know it. So by the time you find that you've injured your foot, now you've got a big smoldering injury, and now you're going to need additional treatment to try to get that wound healed up. And every time that happens, you've got a greater chance of not being able to get the wound healed up, and then it ends up in an amputation.
Okay, doctor.
So is that pretty clear?
Somewhat it is.
Okay. Well, if it's not clear, tell me, because if you're not understanding, that means there's many people in our World Wide Web as well as locally that also aren't understanding.
Well, maybe they are a little better at health and biology than I am. I'm following you pretty well. I'm following you.
Well,
I really can't ask a question on it because you're making it so clear.
Okay. Well, the big key is if you're not following something, tell me, and I'll try and explain it a different way. Because understand, anything you're not following, somebody else is probably not following too.
I understand, yes, sir.
And when I always let people know they can reach me at my office at 252-332-6484. That's 252-332-6484. We're always happy to see new patients. And we have a family practice, a general practice, and we do a lot with alternative medicine, a lot with Alzheimer's disease, a lot with natural hormone therapy. We also have a substance abuse clinic. So a lot of things we like to do, but we really enjoy working with the geriatric population. So those things any of those may be something you need. Call our office, and we're happy to set up an appointment to see you. You can go by my website, which is askdrferguson.com, and there you'll find a lot of nutritional supplements. And you'll find some things you can do, some links you can click on to find some other nutritional sites that may be helpful to you. So all of those things are very important. If you go to the website, you can also go to youtube.com. That's where a lot of people are watching the broadcast live right now. So go to youtube.com/ and that's the bottom, the line right with the question mark. Then you put user, USER, then you use that line with the question mark again. Got to go shift and then the question mark, and that'll give you that line. And then you type in Ask Dr. Ferguson, AskDrFerguson, and that will take you right to my YouTube site. Once you're on the YouTube site, then if you're trying to catch the program live, this program, you go up to the little left-hand corner, you click on the house, and then you click on feed. But if the program's not on, you can look at pre-recorded programs, because they'll be there too, and you'll be able to find them real easy. So you can hear some programs that we've previously done. You can also search around different places on the internet and get access to some other nutrition and preventive healthcare things that you might be interested in. So that's just a brief way that one can reach me and find out more about me. For those of you who know me at all, you know I'm really into photography. So if you want to see some of my photography, you can go by my photography site, which is photomedoc.com. So let's get back a little bit to diabetes. So we've been talking about diabetes for the last several weeks now, and it's a big topic, so it can handle several lectures. We've been really basic today, but hopefully the things we've said have given our listening audience a better understanding of diabetes in general. And, my goal is in all that I get an understanding. And I hope that's what we've done for you and for the many others in our listening audience today.
Well, yes, I've got much more understanding than I did the last time. Actually, it added on to last time I was with you, we spoke on diabetes, and I learned something. And today I learned something. I'm sure I'll learn something the next time too.
Right. So when you talk about diabetes, again, you're talking about, generally you're talking about a resistance to insulin, that the cells are having a resistance to insulin, so consequently it doesn't utilize the insulin as well as it should. So what are some of the things you need to do? What are some things you can do to help in this what we call diabetes? Well, number one on the list is going to be weight loss. So if you're overweight, getting down to your ideal body weight can be very, very effective. If you every time you lose 5 to 10% of your body weight, you're going to have a dramatic effect on your blood sugars and on your blood pressure. So very, very important to think about it like that. What can you do to improve upon the overall situation? So diet, exercise, lifestyle changes, proper sleep, proper eating, proper water, some supplementation. All of those things will contribute to improving the overall course of diabetes. And what's another specific thing you can do? You can get some chromium. I usually recommend 1,000 milligrams of chromium. You get it right over the counter. I usually recommend 1,000 a day. And that helps stabilize the blood sugars so that you're not going up and down like a roller coaster. So chromium is one of those things that can be helpful when you start talking about diabetes.
And Doctor, I know we're almost out of time, but let me ask you this. How about if a person reduces their sugar intake?
Well, anytime you reduce your sugar intake, you may get better control of your diabetes. But also remember that earlier on in this program, I told you that your body lives on sugar. So it needs the sugar, but in the right proportion, and that doesn't need the simple sugars that you get in the candy bar, but it more needs the long chain sugars that become in a starch. So your body has to have the sugar, and chromium is one of the things over the counter that you can utilize to help stabilize the sugars that your body will take in. Other things that can be helpful in diabetes, so we got the chromium, water, drinking a half a gallon of water a day. You need to kind of monitor the amount of water you have based on your size, and usually if you take your ideal body weight and divide that in half, that'll be about how much water you need on a daily basis to sit on the couch and watch TV.
Okay.
So that's a rough estimate on the amount of water. What should you do for exercise? Well, doing some type of exercise 3 to 5 times a week where you get your heart rate up and keep it up for 20 minutes. That can be very helpful in helping with your cardiovascular as well as with your diabetic issues. So we talked a little about the water, then we talked sleep is also very important, that you get the proper sleep every night so that your body can rejuvenate. While you're sleeping, your night crew comes in, and the night crew tries to get rid of all the trash, it tries to get rid of things that happened during the day that weren't correct, tries to fix the broken desks. So the night crew is coming in trying to repair things. And if you are living on a daily basis, you're constantly having cells that function abnormally. And so the night crew comes in and helps repair the cells that are functioning abnormally. And so your body is working 24/7, not as hard while you're sleeping as when you're awake, but you're still burning energy, you're still working hard to try to get all those things set up. And I know we're getting right here to the end. So again, want to always let you know you can contact us at the office, 252-332-6484. You go by the website, AskDrFerguson.com. You go by the YouTube, youtube.com/user/AskDrFerguson. All those places are going to be a great source of information, great source of resources for you. And so I do encourage our listening audience, both near and far, to check out those areas and so that you can learn more about preventive health. So on that note, to you and to our entire listening audience, I'm going to say have a blessed and wonderful day.
And thank you very much, Dr. Ferguson.
All right. Okay, have a great one.
You have a blessed one.
And those of you on the World Wide Web, I want to also remind you to tell your friends to tune in each week, Wednesday, 9:30 to 10. We do the program. It will be live, and the pre-recorded programs you also can catch on the website, Ask Dr. Ferguson, or youtube.com/user/Ask Dr. Ferguson. But tell your friends to join us, come and join us live weekly on Wednesday, 9:30 to 10, and we'll be happy to see you next week. And for all of those that join you this week, be blessed and have a wonderful day. Bye-bye.